Good afternoon, everyone. Welcome. Thank you for joining us today for this landmark announcement. My name is Dr. Jennifer Bensi. I'm your health officer here at the Florida Department of Health in Manatee County. Our 2019 Community Health Assessment, or CHA, data indicated that substance use disorder and behavioral health were combined as one of the top 4 community health issues in Manatee County. Subsequently, together, our partners, we developed a high-level behavioral health subcommittee to address these issues in our Community Health Improvement Plan, or CHIP. Partners include county government, law enforcement, the local chambers of commerce, behavioral health providers, various local nonprofits, treatment providers, local hospitals, and our federally qualified health center. The objectives and activities the Behavioral Health CHIP Subcommittee address include, number 1, increasing the availability and communication of behavioral health and substance use abuse treatment services to address health equity. Some activities include working with partners like Turning Points to address at-risk populations, offering behavioral health resources into the Persons Assisting the Homeless, or PATH, hard copy guide for easy access for their clients. Developing and distributing thousands of wallet cards with a QR code taking persons to the You Are Not Alone landing page, containing all of our partners' local resources with detailed information. Our tracking data show that thousands of people have clicked into this resource to find the help they need. Number 2, providing education to Manatee County residents regarding access to culturally, linguistically, and developmentally appropriate health services. We worked through local partners at 211 and Making an Impact to develop online resources and GIS mapping capabilities for easy and convenient neighborhood access for residents. The GIS mapping data show us that the gaps in services for areas of over 2 miles from a behavioral health resource. These data will assist us as we continue to work on reducing access barriers throughout the county. Partners at MCR Health, the School District of Manatee County, and Centerstone Behavioral Health Center are working with students in Manatee County to address behavioral health through the school-based health clinic model at Southeast High School and Manatee Elementary. We will be adding Daughtry Elementary and continue expanding services that anyone in the public can access, including adult family members, to address prevention efforts. We are also working with partners to address neonatal abstinence syndrome with partners at Healthy Start, MCR Health, and Manatee Memorial Hospital to ensure that these NAS babies and families receive the services they need, including our own Women's, Infants, and Children, or WIC program here at the Health Department. Obviously, we do partnerships very well in Manatee County, and we are continuing to do that today through this initiative. We have many partners here, including Community EMS, Centerstone, MCR Health, Drug Free Manatee, the Central Florida Behavioral Health Network, Manatee Sheriff's Office, and others. Next, I would like to welcome Dr. Kenneth Shepke. Today, we're honored to have this Deputy Secretary with us. Dr. Shepke is a licensed medical doctor who is also a dual board-certified specialist in emergency medicine and the subspecialty of EMS. Dr. Shepke received his medical degree from the Renaissance School of Medicine at Stony Brook University and completed his internship and residency at the Medical Center of Delaware, where he was elected chief resident. Dr. Shepke has more than 25 years of extensive experience in EMS, and his contributions to the field have earned him nationwide recognition. Dr. Shepke has played a significant role in the development of an innovative model of care that we are here to announce today, in collaboration with state agencies and other partners to further Florida's efforts in combating the overdose crisis. Thank you for being with us today, Dr. Shepke, for today's announcement on an issue that is so critical to our community. Welcome.
Thank you, Dr. Bensi. Good afternoon, everyone. I'm honored to be here to announce the rollout of the Coordinated Opioid Recovery Network and the expansion here in Manatee County. Substance use disorder and opioid use disorder have become quite a crisis for us across our country. Here in Florida, we lost over 8,000 people last year to this disease. It's a local phenomenon as well. Last year, 911 was called for over 2,300 overdoses right here in this county. Death by overdose is now the #1 cause for Americans aged 18 to 45. This is an enormous problem. So we developed this program, the Coordinated Opioid Recovery Network, and we modeled it on something that we've done in the past. Back in the late 60s, we faced a similar problem, a crisis of deaths on the highway that gave birth to our 911 EMS and trauma system. We got together as a society and developed a coordinated system of care where a patient suffering trauma goes from 911 through the acute care recovery to long-term recovery and good health. And we've copied that system of care several times. And every time we've copied that system for deadly disease, we see a drop in the death rate and the drop in the morbidity rate. Certainly we've done it for trauma, we've done it for stroke, we've done it for heart attacks, and now we're going to do it for substance use disorder. And that's what's been missing. For so many years, while I was practicing as both emergency medicine and EMS physician, I saw the overdose revolving door occur. My patient would overdose out on the street, 911 would be called. My colleagues in EMS would bring them to the emergency department. We would resuscitate the patient, give them a list of resources that are in the community, ask them to follow up. Some of those resources may have matched up to what their needs were. Some of them might not have, sort of disjointed. Patient would leave, being asked to navigate this complex system on their own, go out into the street, overdose again for the cycle to begin again. That's a failed model that ends today. Now we're here, thanks to the leadership of Governor DeSantis, we are enacting a coordinated system of care, the Coordinated Opioid Recovery System. This is critical because we're facing a crisis now in our nation like we haven't seen before with these drugs. And we're using a three-pronged attack. Under First Lady DeSantis, we're using prevention. She has the Facts Your Future program. This is a program that's designed to educate our youth across our high school and middle schools about the dangers of these drugs and alcohol and how it could create a lifelong illness in you. Hopefully prevent some of those folks from developing this disease. Then there's enforcement. We've all heard the crisis with fentanyl. Fentanyl deaths, overdose deaths, 800% since 2015 has risen. This is horrible. Governor DeSantis signed legislation increasing the penalties on the criminals that are pushing these poisons on our communities. But what's been missing, I think, is the treatment piece. And I'll tell you, frankly, I think the House of Medicine has been slow to recognize this disease for the disease it is. With advanced neuroimaging, we see changes to the brain from this disease. This is a real deal. Once you have this disease, it is a chronic, lifelong, relapsing, life-threatening disease. But we haven't treated it that way in the past. Can you think of any other chronic, lifelong disease that we expect the patient to take nothing? That's faulty logic and it's faulty science. The good news is there actually is very effective medications for substance use disorder, opioid use disorder. We just need to get the patients on it. But it's not just about taking medication. Many of these patients, 80% in fact, that have substance use disorder, also have untreated mental health issues. And you heard a lot from Dr. Bensi about the need for mental health. That's absolutely critical. That's one of the pillars that we need to use. 2/3 of the patients that are using intravenous drugs have hepatitis C. We can now cure hepatitis C. But again, that's another branch, another pillar in the treatment model that we need. Many have HIV. We can suppress the transmission of HIV using medications to get their viral count down to 0. Many have housing insecurity, food insecurity, they might need job training, they might need dental care, et cetera. They have complex needs. This is not a simple problem. It requires a complex system to fix it. So instead of having somebody just overdose, go through the revolving door, hit an ER and leave, now patients can call just a single number, don't even have to overdose, get into the system. If they do overdose, Just like in the trauma system, we don't necessarily take you to just any emergency department. We take you to the emergency department where the healthcare providers in that specific location have specialty training in this disease. They can start the patient on medication-assisted therapy. If the patient requires admission to the hospital for stabilization of comorbid conditions, that'll occur as well. And when the patient leaves, they're not asked to do, hey, go follow up. We guide the patient through the system, match them with the resources they need, give them the lifelong treatment that they need. A couple of take-home points, because this has been misunderstood. I want to have some take-home messages. Patients who have this disease can no more choose to no longer have this disease than someone with diabetes or emphysema choose to not have those diseases once they've gotten them. These are diseases that you have for life. It requires lifelong coordinated care. So I'm so happy to be here and working with my partners to roll this out, but we cannot do this alone. We certainly need a lot of our local help, which you're going to hear from, and there's certainly our state partners under Governor DeSantis and First Lady DeSantis' leadership, the Agency for Healthcare Administration, and of course the Department of Children and Families are our most important partner at the state. So it's my privilege to introduce Secretary Siobhan Harris from DCF.
Thank you, everyone, and thank you, Dr. Shepke. Good afternoon. It's truly an honor to be with you this afternoon to launch the Coordinated Opioid Recovery Network here in Manatee County. The CORE Network is not only an initiative, but a comprehensive world-class model of care that Florida is implementing to address substance use disorders. We are immensely grateful for Governor DeSantis championing this first-of-its-kind initiative and for the Department of Health leaders who have stepped up to bring their vast experience to the table. This, combined with our First Lady's commitment to increasing behavioral health services and tackling the stigma associated with asking for help, has led to innovative and life-saving partnerships like the one you see here today with the CORE Network. As the state's opioid treatment authority, we at the Department of Children and Families take our responsibility very serious to provide high-quality addiction and substance abuse treatment through a network of community-based partners. In Manatee County, there are 3 medication-assisted treatment organizations and 16 certified recovery peer specialists, 7 naloxone distributors, and many wonderful partners to support the launch of CORE locally. I'm confident that bringing the CORE network here will certainly be a complement to the myriad of services that are already available. Since Governor DeSantis took office, $1.4 billion has been invested into detoxification services, recovery, and treatment supports for youth and adults. Last fiscal year alone, we provided substance abuse treatment services to more than 68,000 children and adults. Addiction is a disease unlike any other in that it not only affects the person physically, but we know that it can cause behavioral challenges and issues that impact your ability to sustain relationships and also to maintain the dreams, hopes, and desires that you once had for yourself. Rather than being an acute and episodic illness, it is a lifelong journey, like what Dr. Shepke has already stated, and recovery extends far beyond crisis treatment and stabilization. The CORE model is a great example in that it brings together key state and local partners to address short and long-term medical, physical, psychological, and emotional aspects of this disease state. At the department, we are not only acutely interested in this because of our role in behavioral health. As you all know, we are responsible for child protection services, and in over 50% of the cases where we have to remove a child from their biological parent, it is because there's evidence of substance use in the household. And so it's really important for us to invest our dollars wisely on evidence-based strategies that help to keep family units intact, but also to ensure that we are helping individuals on the recovery process using the most effective tools and strategies. There is no greater redemption story than that of a parent who's done the hard work to enter the recovery phase, to do all the hard things to win their child back. We are also proud to put forth resources that support social determinants of health, like addressing housing instability, food insecurity, and stable employment. Through the First Lady's Hope Florida, a Pathway to Prosperity initiative, our Hope Navigators stand ready to work with peer coaches and the treatment team to help individuals achieve their version of self-sufficiency and avoid preventable relapses due to these kinds of life stressors. I'm confident that we can reduce the devastating impact that opioids are having on our children, on our families, and our community. I'm really excited to be a part of this initiative. I hope you can see that. And so I look forward to all the wins and gains that we will achieve. With that, I will introduce James Crutchfield, Deputy Director of Public Safety and EMS Chief here in Manatee County.
Thank you. Manatee County government is wrapping up its 50th year of EMS service, where the county has provided emergency medical response to the people and visitors for 50 years. The county EMS service continues to be innovative and fulfill critical roles in the healthcare continuum. The county established its community paramedic program in 2016, where addressing medical and social barriers was the program's building blocks that fundamentally improved clients' and patients' quality of life. Participating in the core initiative was a no-brainer for public safety, where we can leverage our established community paramedic framework to encourage those using evidence-based medicines to save their own lives and be productive members of society. Our goal in partnering with the core is simple: increase access, decrease barriers, help individuals who are experiencing opioid use disorder, and to allow them to stay in treatment.
Good afternoon. Welcome. Before I start, I just want to emphasize, listen to the points of Dr. Shepke, Dr. Bensi, and Madam Secretary. They got it right on the mark. It's so good. So, I'm Dr. Bill Colgate, representing MCR Health, one of the partners. I'm the Senior Director of Community Affairs and Chief Operating Officer of our accountable care organization, All Care Options. We are honored to communicate and collaborate with our other partners who are present here and others outside of here today as we further address the opioid use situation. Our role in this endeavor is to play a committed role in the long-term caring and treatment of those dealing with opioid use and recovery. And I'm glad it was brought up about Hep C and HIV. That's one of the clinics that we have as well, is Hep C and HIV. At MCR Health, we will provide long-term addiction and behavioral health services with individual and group therapy. A primary care medical home, as was also mentioned accurately. There's often other health issues in addition to just the lifelong addiction, either in recovery or not. We'll be able to provide pharmacy services as a federally qualified health center, so it's on sliding fee scale for those that come to us. Services and access and relationships with other health and social services. Thank you very much to the state, Governor DeSantis and other leaders for taking this innovative program that's already been time-tested and giving us the opportunity, sorry, I get emotional about this. Deaths don't make me very happy. I'm an ER doc. So in closing, MCR Health is proud to collaborate with our esteemed partners for the health and well-being of our incredible community. Thank you. Oh, next will be, I moved it over here. Dr. Linda Thompson, Executive Director and CEO of Drug Free Manatee, and I know firsthand they do an incredible job for our community.
Thank you very much. Building upon what's been said here, I come from a different perspective. By training, I'm a family therapist, so I think systemically, and I always tell my students, once you think systemically, you never think another way. So as we look at our role here with the CORE program, we kind of stepped out of our swim lane a little bit as we looked at what was going on in the community. And I would be remiss to not mention that our program that's contributing to this fantastic initiative was born out of a single phone call in the fall of 2020 from a mother who said, I just lost my son. And I'm sitting in my office, it's COVID, right? And I'm thinking, tell me your story, because that's what we say in family therapy, tell me your story. And she said, well, he was an addict, but he didn't die because of the drugs. He died because he got hit by a car walking across the street. And she said, I've grieved for 4 weeks now, and I'm tired of grieving, and I want to turn my grief into something meaningful. Because the headline read, homeless man dies on Cortez. She goes, Dr. Thompson, my son was not homeless, and I don't want his legacy to be that. I said, tell me what would make a difference. Tell me your story. And her story led to us creating Family and Friends Support Network. She said, nobody was there at those pivotal points for me. Nobody was there in the emergency room talking to me about what this all meant when my son overdosed, time after time after time. Nobody was there to explain the Marchman Act to me. Nobody was there to say, here's what you do next. Here's how you survive this. Here's how you save the rest of your family. And she said, I don't want other families to go through this. What can we do? So I started by saying we can make the resources available at the point of contact. But the resources were there at the point of contact. She said, it has to be more. So we did our research, we did our searching, and we decided that what families need at that moment is another family who's had lived experience, who knows what they're going through, and can say, here's what you do now. Here's how you get through this. Here's how we know what's going on with you. To fight the stigma, to fight the guilt, to fight the shame of this horrible disease, because addiction does not form in isolation. It forms in families, communities, and even though we give that Narcan out, there's a whole lot of people standing around saying, what do we do next, right? So we've worked very closely with Jimmy's people, thank you for that partnership, to make sure that Leave Behind kits are available for the families, that explains opioids, that explains all the resources, and that gives them 2 extra doses of Narcan because that person's coming home, right? And maybe they won't have to call Jimmy next time. So we took this idea, and what we've created is something very unique. It's not like NA. It's not like sit around and we'll support each other. It's a structure. It's a structure with trained facilitators in an evidence-based curriculum to talk about the science, to talk about the education, to talk about all of that with people who have lived experience. But it's also then, let's also be there at the point of contact. My dream, and I may not be here to see it, but I want it to happen, so promise me it will happen. My dream is that someone comes to the ER to get help for their loved ones,
and someone hands them a card and says, call these people right now. And that there's another family on the end of that line that says, we'll be right there. So thank you for letting Drug-Free Manatee be a part of this, and I can't wait to see what it becomes. Thank you. Next is Jessica McCarthy from Centerstone.
Good afternoon, everybody. Thank you for having us today. Centerstone is a nonprofit healthcare system providing mental health and substance use disorder treatments. Services are available nationally through the operation of our outpatient clinics, residential programs, and the use of telehealth and our local inpatient hospital. Locally, we've been a pillar here in the community since 1955, serving Manatee County. Over the years, we've expanded our services into Sarasota, DeSoto, Glades, Hendry, and Lee counties. And we even have reach across the East Coast, partnering with the Cohen's Veteran Clinic in Jacksonville. We're proud to report that last year, we provided 500,000 services to over 16,000 patients across the state. We're so excited to team up with everyone in this room and partner with these community partners that we've worked with for so long to continue to fight the opioid crisis here in Manatee County and across the state. I'm privileged to introduce you to my colleague, Sarah Holloway, our CORE Peer Project Supervisor, to share her personal journey and more details about how the CORE program works. Thank you.
Good afternoon, everyone. My name is Sarah Holloway. I am the supervisor of Centerstone's Core Peer Program. I am also a certified recovery peer specialist, and I'm a person in long-term recovery. It's working in my role as a certified peer that I'm able to give back to the community and foster hope within individuals who are struggling in active addiction and are in early stages of recovery, as well as give back to the community in which I have found that same hope. A little over 13 years ago, I was struggling to find my own hope. I was completely hopeless. I was in a dark, miserable place in my life, struggling in a battle of opiate addiction amongst other addictions that I possessed. I had failed at sobriety more times than I can care to count or remember. I began using substances in my early teens and was addicted by the time I was 17 years old. I was in and out of institutions. At this point, I was completely physically, emotionally, and spiritually bankrupt. It was at this crossroads in my life, at the lowest point, that I was afforded the opportunity and guidance to go to residential treatment. This was where my recovery journey began, and although I was apprehensive in this transition, as most of us would be, I fortunately this time chose the road to recovery in life. It was in that residential treatment program that I first encountered a peer specialist. I was confused at first as to what their role was, what role they would play in my own recovery process. Were they a sponsor, a case manager, or a counselor? I was surprised to learn that they were in fact none of these things. They were my equal. They were there to support me, guide me, share their lived experience with me, sit in the passenger seat while I drove and learned how to live my life in early recovery. In working with them, I created my own long-term goal to get involved in the recovery community, to give back when and where possible, and ultimately find a career, as I have now, in peer support. Peer support is an evidence-based practice that is often seen within treatment settings involving individuals who are established in recovery, guiding others in early stages of recovery by using their lived practical experiences. SAMHSA explains peer support workers as those who are successful in their recovery process, guiding others who are in similar situations. Peer support offers effective extended reach beyond the limits of the clinical setting into everyday environment of those who wish to attain a successfully sustained recovery process. The Core Peer Program, which I'm proud to be a part of, involves a system of 3 peers that engage individuals that overdose. The peer specialists that are assigned within this program work in collaboration with previously identified community partners to deliver the evidence-based practice peer support services that I spoke about. Once contact is made, the peers provide resources and encouragement for continued treatment of the opioid use disorder by including MAT services. If accepted, the peers manage a warm handoff to a selected MAT provider while continuing to offer support for the client throughout their finding stability and treatment services. In addition, the program has fully trained staff answering a 24-hour hotline and they will provide resources for community-based services as well as immediate response. The number for that line is 941-780-9408. I want to thank you all for allowing me to be here today, share a little bit of my personal experience and my struggle with you. We look forward to working with community partners and getting the program off the ground. Thank you. You're welcome.
Thank you, Sarah. No one does more work in public health than those peers that can help someone and talk to them about what they truly understand. So thank you so much for your work and being with us today. And thanks to all the partners here. We have quite a bit of work ahead of us, but we are off to a wonderful start. I want to thank also Dr. Mary Beth Zenny. She has been coordinating with all of our partners over the past few months, making sure that everything is in order and we are ready to go. All those details to make sure that we're not missing anything along the way. Same with Jane Roseborough being our liaison at Centerstone. Tom McDougall, our CEO of Manatee Memorial Hospital, here with us. Thank you so much. Sally Dion from Vern Buchanan's office, thank you so much. Sally Shealy now. So many people, Senator Boyd as well, obviously. Mr. Buchanan has just done an amazing job in supporting us over the years in all of these initiatives. And we need everybody. And we're so pleased that all of you could be with us today. And we're getting this word out to the community. We'll have the number out to make sure that anyone who needs that service is available to call 24/7. Someone will be there to answer the phone and help you through this journey with us together and many of our community partners as well. And we can't thank you enough for being here. This is the holiday season. There are a lot of material gifts that come with that, but something like this is an extreme gift that lasts a lifetime. And so we're very, very grateful to the state, Dr. Shepke, Ms. Harris, for being with us today and leading this effort across the state. And we're one of, as you heard, 13 counties. We hope that this will expand to 67 counties in Florida very soon. Thank you again. With that, I'm going to turn it over to Shay Chapman from the Florida Department of Health in Tallahassee, and she'll answer any questions from the media. Thank you. Shay.
Hi, good afternoon. Thank you, Dr. Bensi. At this time, we're going to open it up for questions from the media. Any questions? Okay, well, we thank you all for your time and coming today and covering this press conference. Thank you for DOH Manatee for hosting us and for all the wonderful partners. And thank you, Sarah, for sharing your story. We look forward to seeing all your success here in Manatee County. Thank you.